Isabelle. So we are going to go ahead and begin with your examination this evening. And I'm going to begin by having a look at the area overall. So let me just start by putting on a pair of gloves so that we can get started. Now, I know you said you were having quite a bit of sciatic nerve pain, and this is something that you have struggled with for some time now, right? Okay. So let's go ahead and have a look at the affected area and see if I can get a better idea of what might be going on. If this is true sciatica, then there are different things that we can look at, different treatment courses that we might be applying to you in the future. But for now, I would like to get a look at the overall area, get a feel for things and see if I can see anything that might be causing this pain, okay? So I know you said it's been pretty uncomfortable for you. Yeah. Okay. So typically sciatic pain tends to can extend as far as the kind of lower back region, down the center of the buttock, and down the back of the thigh is where we hear the majority of our pain complaints. So that's about where you're feeling it as well. Okay. Mostly on this side, you said. You don't really feel it on the other side at all. Okay. All right, so we will be having a look at that today. And can you tell me about where that starts? So as I come down your back, do you feel it here? A little bit? Okay. Gets worse here? Okay. You really feel a lot of the pain here, kind of at the base of your thigh? Okay. And does it run as far as to the back of your knee? Sometimes it is that severe. Okay. All right, so definitely something that we need to look into. And you don't feel it really at all on the other side. Okay. Any previous injuries to this leg? No. Back injury, but quite a while ago. Okay. Okay, so I know you said you work from home, so you sit at a desk quite frequently. Okay. Now, are you sitting in an office chair? Like a regular chair. Do you know if it's ergonomic? It's not, it's just like a regular office chair. Okay. So that's likely the cause of the pain if I had to guess. Unfortunately, if you don't have a well-constructed kind of desk chair, office chair, it tends to cut you in a weird place behind the thigh. So that pressure that's being put on the sciatic nerve can then extend up into the buttock area, and that's why you're having that pain. Could also be due to a pinched nerve. Several different things that could be going on. So let's go ahead and start by having a look initially. So I'm just going to begin by kind of observing the area as a whole. So what I'm looking for is any obvious signs on an external level of asymmetry. So essentially, with my point of view now, I can see both sides of your back, both sides of your bottom, and both of your legs. So I'm looking for any signs of asymmetry, any possible dislocation, which is a stretch as far as I'm concerned. But I am looking for any signs of abnormal swelling, any areas that appear to be edematous or more swollen in comparison to the other side. So looking for any signs of abnormality there. And I'm also looking to see the alignment of your hips in comparison to your thighs, as well as having a look at your posture. Now, I know you do have an ankle injury, unfortunately, unrelated to this incident, which is why you have your leg extended off the table there. So that is perfectly fine, and that will not be an indicator of this examination. So while it does appear that you are laying crooked, that is simply to accommodate your injury. So I will note that as well. Now, having a look at the back of the thigh, I do notice maybe just a little bit of swelling in this area. And possibly some right here, right below that lower buttock, extending into the back of your thigh. So what I think I want to do now is move into some palpations. So what that means is that I'll be using my hands to kind of gently press on certain areas, and I'd like you to just indicate if it's painful at all to you, okay? Or where exactly it is. Okay. So as I press on this area here, does that bring you any discomfort? Just a little bit of pressure. Okay. And as we move here to the tailbone area, just a little bit. I palpate directly across. Is that uncomfortable at all? Does any of that pain extend up to the top of the thigh? So you would say most of the pain is isolated to this area? Okay. Now, are there any positions that you lie in or sit in that make it less painful? So lying on your back, you would say, is the most painful. Okay. Okay, so that's pretty indicative of sciatica. That is something that I hear from most, if not all, of my patients. Okay. So we're going to go ahead and move on to a couple different tests here. So I think what I want to do initially is just get a couple of these measurements. Now, these will help us comparatively when you come back for your follow-up examination. So then we can redo your measurements and have a little bit of a better look to see if any of the swelling has gone down, or if your measurements remain the same, then this might be an indication that this is about your baseline, okay? So I am going to measure from about the small of your back to kind of parallel here to your tailbone. So we're at about roughly 5 inches. And if I just kind of mark that with my finger, then we can make that our first measurement here. So about 9 inches from tailbone to the top of the thigh. And about 11 1/4, we'll say 11 1/2 to the back of the knee. Okay. I'm just going to measure so get about 11 inches there. Measure diagonally from the top of the hip to the kind of hip bone here to the inner thigh. That's at about 16 1/4. Whereas that's at about 13. Okay. So that just gives me a little bit of an idea, something to know, and then we will come back to that on your next visit and see if there's any significant changes there. Okay. So let's go ahead and move on. I'm going to do a very brief reflection test with my light. So what I'm going to do is just shine my light at a certain angle, and this just allows me to see whereabouts the reflection indicates. Just another test to note any abnormal swelling. So far, all of that looks good. Okay. So I'm not seeing anything too abnormal here. I think we're probably okay to proceed. Okay. All right, so we did our palpations. Now I would like to move on to some percussions. So essentially what that means is I'm going to be going in with a reflex hammer. Now, this is a rubber kind of mallet texture, so it's not going to cause you any pain, at least not externally, but I do want you to indicate to me whether or not anything internal feels more painful as I apply pressure with my hammer, okay? Okay, so we're going to start here, and I'm going to run straight down the sciatic nerve. again, you just let me know if any of this is overly painful. Painful there? Okay. Not as bad as we move down. And it's okay everywhere else. Okay. So is it only painful directly on the nerve, or is it any less painful as I move away? Not as bad. Okay. Here. Not as bad. Okay. All right. So that's a good indication of kind of isolated pain here. Now, just to ensure that your neurological functions are intact before we proceed with the examination, I do just want you to indicate whether or not you feel this. So just say yes if and when you feel it, okay? So this is very brief. You feel this here? Good. Probably can't feel that it's cold, but you do feel sensation here. Good. And you feel this all the way down. You're able to feel me touching you. And you feel this here? Good. And again, all the way down, you're able to feel that I'm touching you. It should now feel cold. Good. Very good. Any difference in sensation anywhere as we move up laterally along that sciatic nerve? All of that feels the same. Good. And if we move out this way, all of that feels the same as well. So there are no changes as we move out and away. And again, all of that feels the same. Perfect. Okay, you're doing so well. Okay, so the last thing I'm going to test as far as your neurological response is pain response. So I'm going to be applying a painful stimuli to the skin as well as above your shorts. Now you should feel this as it is quite sharp. Now when I say pain response, I don't mean that it's going to inflict pain upon you. I do mean that it is a very sharp tool and you should feel something, mostly discomfort, but it's certainly not enough to penetrate the skin or cause you any harm in any way externally, okay? Now specifically over your shorts, you will probably barely feel it, but you should still be able to feel that it is sharp, okay? So you should feel definitely here that this is very sharp. Good. Okay. So you still feel that it's sharp here. Very good. And you feel that here as well. Perfect. Everywhere here you feel that that is sharp. Very good. And of course here as well is very sharp. Okay. Any more or less sharp on that area there? Feels a little bit more sharp. So you're having some slight tenderness there. Okay. In comparison to here, that feels a little more sharp. Okay. Is that the same up here? Less sharp here. Less sharp here. Less sharp. But still feels more sharp here. Okay. Alright, so that is something for me to know. Go in with one more tool before we move on to our therapies, and just want to see if there's any major difference here, considering you are having some kind of adverse reaction to that stimuli. So what I'm doing is just measuring bilaterally and just checking to see if the two sides are particularly different, which I'm not getting positive indication of that, which is a good sign. Okay, so of course we'd like to see some relative symmetry. It doesn't have to be exact, but I do want to make sure that there's not any signs of grave swelling. So that actually doesn't look too bad. So that's really good news. Okay. All right, Isabel, so let's go ahead and move on to the treatment portion of your examination. And what I'd say is that, well, I can't say with 100% certainty that this is sciatic pain that you are feeling. It is likely that this is a positive indication of sciatica. So essentially you're having some swelling or some compression that's being put on your nerve, which is causing pain to shoot vertically up and down your leg as well as your back. So we can treat that a variety of ways. I think today I'd like to try some topical cupping. So what we're going to do is apply a cupping mechanism to certain areas, following that sciatic line as well as some of the surrounding areas, and hopefully that should provide you with a little bit of relief. In the long term, I would say you will likely need to do continuous cupping therapy. I do have some patients who come back for acupressure therapy as well as acupuncture. I can also recommend you some stretching that will help with the pain as well. And of course, the probably biggest recommendation that I would give you is to switch out your chair if you can. Yeah, so sometimes we can even get your insurance to cover it because it is technically a medical device that you would need. So if that's a route that you would like to take, we can look into that for you, okay? Absolutely. Okay. So let's go ahead and get started. And I'm going to go in with my cupping therapy. So let's start with a bit of a larger cup here. And what I'm going to be doing is placing this on the surface and essentially siphoning out the air, and that is going to create a suction that pulls your blood essentially to the surface of the skin, okay? I'm going to start at the lower back. Just going to pull this down very slightly and place my first cup here. Perfect. So we'll leave that there. And I'm going to place another one directly at the base behind the thigh. Perfect. So as far as the thigh area, I don't think I'm going to be able to cup over your clothing. Just going to manipulate your shorts just slightly. So just enough to expose the area. Very good. Now I think I'm going to take a smaller cup to this inner thigh. Okay, so I'm going to place one here on that inner thigh. Very good. Okay. I've done is placed a cup at the very start of where you're feeling some of that sciatic pain. And then of course we'd follow that down, placed one here kind of slightly lower than the base of your lower thigh, as well as here where you said is the last part where you were feeling that pain. And then just a surrounding cup, so we're essentially trying to encase the area and create healing kind of in this sciatic nerve region. Okay, so I'm going to give those just a couple more seconds. I'm already seeing very healthy blood flow return here. And while those are sitting, I'm going to use a different tool to kind of slightly manipulate the area, okay? So I have a wooden tool here that I'll be using to follow down that sciatic nerve and hopefully provide relief, as well as move some of that fluid and encourage it to drain towards your feet. Okay, so I'm gonna start here, just moving in linear motion, encouraging draining of that sciatic nerve. And essentially what we're doing is encouraging any fluid buildup, any fluid retention to drain out naturally, down away from the heart and towards the feet. Beautiful. That appears to be working appropriately. And just going in with the other side of my tool and applying a very gentle circular pressure. Again, encouraging any excess fluid to drain down and away, as well as reduce inflammation. Okay. So I'm going to go ahead and remove our first cup. Very good. So the pinkening of the skin is very normal. And while it may bruise just slightly, it should go down in just a matter of a day or two, okay? Very good. Let's go ahead and remove our second cup. Very good. So as we can see, there's less of a reaction here, whereas here we did get a lot of those capillaries to come to the surface of the skin. Moving our third cup. Very good. Decent reaction there as well. And our last cup. Very good. And I did get a good reaction here as well, so that's a good indication that we did remove some of that inflammation from the sciatic area. So that is very good news. Okay. Just going to pull your shorts back into place. We can proceed. I would like to do just a little bit more of this manipulation here, okay? So I'm just going to continue to encourage draining of the fluid here, moving down away from the heart, following that sciatic nerve line. And then we're going to pay some special attention to this area that you said was the most painful, okay? So I am just going to come just a little bit closer to you here so that I can follow this here. Very gentle but firm pressure, going right over the area, encouraging draining of any of that excess fluid. Good. This feels a little bit better. Yeah. So luckily this therapy does have some immediate relief, which is good news, of course, for our patients. Just going to continue to follow that out and away. Very good. I do feel a little bit of tension release there. It's not quite as tight as it was initially, so that's very good news. Okay. All right, Isabelle. Well, I would say that concludes your examination today. At this point, I am comfortable giving you a positive diagnosis of sciatica. So essentially your sciatic nerve has become inflamed due to lifestyle and situational circumstance. So I'd like you to proceed with the therapies that we previously discussed. So I'm going to send you a couple links. It's going to consist of some stretching exercises that you can do that will really help relieve some of that pain. Specifically in the morning, you can do some of the exercises in bed, or you can do them out of bed, whatever is more comfortable for you. But those are really going to help you get your stretching in and help some of that mobility before you get your day started. And then of course I would like you to follow up with that as indicated in the link that's provided to you. So I believe it's every 2 to 4 hours. You're going to want to perform at least 5 minutes of stretching, okay? Okay, perfect. All right, so let's try that for at least 2 to 4 weeks. If you can get yourself over to a chiropractor, that would probably be a good idea, just to make sure that there are no adjustments that need to be done, specifically in the pelvic region, lower back, and then of course in the hips. Sometimes misalignment can be a reason for some of that sciatic nerve pressure. So I would recommend that as well, and I can give you a referral to that. Of course, absolutely. So I will send that referral over to your patient portal as well. Okay. In about 4 weeks, if you're not feeling any relief with the stretching as well as with seeing your chiropractor at least one time, I would like you to come back for a secondary cupping therapy and maybe we can go more in depth, okay? Okay, perfect. All right, so what I'm gonna do is give you a couple minutes to rest. You can take your time. When you're ready, you can go ahead and get dressed and you're welcome to head to the front desk if you need any information about your patient portal. If not, you can be on your way for the evening, okay? Perfect. Okay. Thank you so much for coming in tonight, Isabelle. I hope you get to feeling better. Take care.